Good morning. Don't downgrade your dream just to fit your reality. Upgrade your conviction to match your destiny. Yeah, so we continue with the third topic, that is hepatitis virus, which is one of the important aspect in terms of that of the dentistry and medical practices, under which hepatitis B is the most common infection which is seen. So yeah, we continue. The content which include first is the hepatitis virus, that is hepatitis A virus, which which is also known as infective hepatitis, which will include the introduction, morphology, biochemical reaction, the lab diagnosis, and the hepatitis A deficiency. And the hepatitis B virus, which is also known as serum hepatitis, will include the content as introduction, morphology, the antigenic structure, the mode of transmission, the clinical features, the HBV carriers, that is the hepatitis B carriers, the laboratory diagnosis, and the prophylaxis with the clinical dentistry aspects. So yeah, we go into detail with that of the hepatitis virus. So coming on to the hepatitis virus, the hepatitis virus, that is hepatitis A virus, is also known as infective hepatitis. It is a subacute disease occurring mainly in the children and young adults. The transmission route is an oral route. Largely, it's asymptomatic in nature. The two stages are the prodromal or the pre-icetric stage, and the second stage is known as icetric stage. The symptoms are malaise, fever, anorexia, nausea, vomit, liver tenderness, etc. Coming on to that of the next point, that is, it subsides with the onset of jaundice, and the recovery is approximately in 4 to 6 weeks. The morphology, as you can see, it is an icosahedral symmetry, that is, it's a type of pentagon which will be a form of that of the RNA virus belonging to that of the picornavirus family, and the length of the RNA is approximately 27 nanometer, and it is non-enveloped, single-stranded with an icosahedral symmetry. Coming on to that of the lab diagnosis. The lab diagnosis includes the three tests, that is the demonstration of that of the virus, the detection of antibody, and the biochemical test. So demonstration of virus can be done with the help of IEM, that is the immunoelectron microscopy, that is the virus is visualized by the help of IEM in the feces. Coming on to that of the most predominant test, that is the ELISA, that is enzyme linked immunosorbent assay, that is the virus is detected in the feces with the help of ELISA. The isolation of the virus can be done by culturing in human and semen cultures. Coming on to the detection of antibody, it is yet difficult of isolation and detection, yet demonstration of specific antibody of hepatitis A virus in the blood is done, and there are special ELISA kits which is used to detect the IgM and IgG antibodies. Coming on to that of the biochemical test, it is diagnosed by presence of alanine aminotransferase test, that is the ALT test, and the bilirubin supplements. Coming on to that of the hepatitis A in clinical dentistry, it mainly spreads to that of the close contact with the saliva, which may transmit if the saliva is contained in that of the virus. So coming on some of the important points of this slide, the first will be the hepatitis A virus, or it is also known as infectious hepatitis. The introduction points would include it's a subacute disease which occurs in mainly young children or young adults, and oral route is the mode of transmission, and it has two stages, that is the pre-icetric and the icetric stage, and the recovery is within 4 to 6 weeks. Coming on to the next point, that is the morphology. The morphology is it's about 27 nanometer in that of the length, and single-stranded icosahedral symmetry, and it's an RNA virus belonging to that of the picornavirus family. Coming on to that of the lab diagnosis. The lab diagnosis is totally divided into three. There is a demonstration of virus which can be done with the help of IEM, ELISA, and the isolation of virus can be done. Also, it includes detection of antibody, and the biochemical test is a third part. Coming to that of the hepatitis A in that of the clinical dentistry, mainly it spreads to that of the close contact with saliva if the virus is contained in that of the saliva. So in generally, hepatitis A is a type of short note which can mainly occur in that of the final exams. Coming to the next part, we come into the main and the deepest part of that of the hepatitis B virus. So hepatitis B virus, it can appear as an essay for both medical and dental students. So hepatitis B or HBV, or it is also known as serum hepatitis, it belongs to the family of hepatinovirus, which is a type of DNA virus. So hepatitis A virus is an RNA virus, while hepatitis B virus is an DNA virus. Coming to the morphology is approximately 42 nanometer. It is double shell particle. Coming on to that of the virus contains HBsAg, HBcAg, and circular double stranded DNA and DNA polymerase. The HBsAg is a surface antigen, while HBcAg encloses inner icosahedral 27 nanometer nucleocapsid core. The circular double-stranded DNA and also DNA polymerase is present. Coming on to that of the antigenic structure. The antigenic structure would include HBsAg, HBcAg, HBeAg, and that of the viral gene and antigen. Coming on to that of the HBsAg. The HBsAg is a surface antigen which is an envelope protein. The HBcAg is a core, that is the nucleocapsid antigen, and also it is not detected in that of the patient's blood. Coming on to that of the HBeAg, that is, it is an hidden antigenic component of cure. Coming on to that of the viral genes and the antigen, the two linear strands of DNA is present in a circular configuration. It is associated with one strand of DNA and it has a DNA polymerase. This polymerase is like forming that of the repair and in the gap and its incomplete strand and also render the genome double-stranded. The structure of HBV is given in the right side, that is, it has a length of that of the 27 nanometer and the nucleocapsid contains the HBc antigen, while that of the DNA which is present is like positive and negative strands both are coiled, and the DNA dependent DNA polymerase which is present inside with it, and the outer part is known as the envelope. Coming on to that of the mode of transmission. So there are totally three modes of transmission by which hepatitis B can be transmitted. The first one is parenteral, the second one is perinatal, the third one is sexual. So first the parenteral route. So the infection spread by inoculation of minute amount of blood or blood products or fluid containing HBV during medical and dental procedures. Also the perinatal transmission. The perinatal transmission occurs from that of the mother to that of the child. That is, the transmission of carrier mother contaminates the mucous membrane of the fetus. The sexual mode of transmission. The HBV virus can be seen in vaginal secretion, semen. Thus, transmission is also occurring to that of the sexual contact. Coming to the clinical features, the clinical features would include it has a slow onset and an incubation is 6 weeks to that of the 6 months. As we had seen in HAV, that is the hepatitis A virus, it is divided into two phases. Here it is divided into 3 phases. So the 2 phases there were in that of the HAV, it was pre-icentric and the icentric. But here the 3 phases is pre-icentric and convalescent phases. So the pre-icentric phase is the patient develop malaise, anorexia, weakness, myalgia, nausea and vomiting. And the icentric phase, the patient develops jaundice, pale stools and dark urine. In the dark urine, that is the release of bilirubin in that of the urine, so it is known as bilirubinuria. So coming to convalescence phase, that is, it is the longest phase and drawn out with malaise and fatigue. There are some carriers of that of the hepatitis B. So these are known as super carriers and simple carriers. So the super carriers have HBeAg in the blood and high infectious and very minute amount of blood/serum which transmit through infection, and thus they are called as super carriers. Coming on to that of the simple carriers, so there will be no HBeAg and low amount of HBsAg in the blood, and they transmit when large volume of blood causes like blood transfusion and others, and thus these are known as simple carriers. So coming on to that of the lab diagnosis, the lab diagnosis can be done with the help of 3 main procedures, that is detection of viral DNA polymerase, detection of viral markers and the PCR test. So the viral DNA polymerase appear in the serum during that of the pre-icentric stage, while that of the PCR technique, which is one of the highly sensitive technique, and the serum DNA HBV level is tested with the help of PCR. Coming on to the center part, that is the detection of viral markers. So there are totally 3 important viral markers which are present, that is HBsAg, HBeAg and HBcAg. So the HBsAg is the first marker seen in the blood after infection and disappears after recovery, yet stays in the carriers. The HBsAg antibody appears after weeks of disappearance of HBsAg and persists for a long period of time. Anti-HBs is a protective type of antibody. Coming to HBeAg, it's a highly infectious and anti-HBe that is has a little amount of infectivity. HBeAg presents as an adverse prognostic sign, and the disappearance of HBeAg is followed by appearance of anti-HBe. Coming to the last one, that is HBcAg, that is, it is not detected in the serum and seen in the liver cells by immunofluorescence. The appearance of HBsAg, that is in a week or 2, anti-HBc antibody appear and it remains for a lifelong time. That is, it serves as a useful indicator of HBV infection even when all the other markers becomes undetectable. So there are totally 3 viral markers which you have to remember, that is HBsAg, HBeAg and HBcAg. So there is one graph which I had just included here, which is that took from that of the textbook. So it shows the months of the exposure and the different viral markers which are present during the different stages. So coming to that of the important points of this slide. The first one would be the introduction, that it belongs to the hepatitis virus, which is a DNA virus. Coming to the morphology, the morphological points would include it's a 42 nanometer in that of the length, and it's double shell particle, and the virus contains three types of antigen. That is, virus contains HBsAg, HBeAg, and also it contains circular double-stranded DNA with the presence of DNA polymerase. Coming to the antigenic structure, it contains three antigens, that is HBsAg, HBeAg, HBcAg, viral genes, and that of the antigen. Coming to the transmission occurs mainly through that of the three modes, that is parenteral, perinatal, and sexual route of transmission. The clinical features would include pre-isolatic, and the convalescence phase. And some of the carriers are the two types of carriers, that is the super carriers and the simple carriers. And in the last, the lab diagnosis would include viral DNA polymerase, the detection of viral markers, that is HBsAg, HBeAg, and the HBcAg, with the last technique, which is highly sensitive, known as the polymerase chain reaction and the PCR. Coming to the end part of the HBV, that is the prophylaxis. The prophylaxis will include generally two aspects. One is the general preventive measures, and another is the immunization. So coming on to the general preventive measures, which is generally took by a doctor or a dentist while practicing. So this will include the health education and improve the personal hygiene and strict attention to that of the stability, and also use only discard that of the unsterile needle and syringe and other materials when after it's used. Coming to the immunization, it is done by two methods, that is active immunization and passive immunization. So what is immunization? Actually, the immunization is given for HBV by 3 doses, that is at 0, 1st, and the 6th month, the administration into the deltoid muscle. The active immunization is plasma-derived vaccine and also the recombinant yeast hepatitis B vaccine. The passive immunization is also present. Coming to the active immunization, the plasma-derived vaccine. It is the vaccine which is immunogenic and safe and prepared by purifying 22 nanometer particle of HBsAg from plasma of healthy carriers. The recombinant yeast hepatitis B vaccine, that is produced by recombinant DNA in yeast, in which the plasmid containing HBsAg is incorporated, and the vaccine is immunogenic and safe. So both the vaccines are in this active immunization are immunogenic and safe. So that is one of the common point. Coming on to the passive immunization, that is it employed for accidental exposure of HBV while doing a dental procedure or dealing with a patient. Sometimes a doctor may be exposed. So this type of passive immunization is very helpful for these people. Coming to HB immunoglobulin, which is prepared from the donors with a high titer of anti-HBs, and it is given 300 to 500 IV or IM route. It also doesn't prevent, but it just protects from that of the infection. So the prophylaxis will include general and also immunization. Last one, that is the clinical dentistry. So some of the points which are important for the dental aspects, we have to write about the parenteral route of transmission and the increased risk of infection while doing a clinical dental practice. So the mode of transmission would be from the patient to the dentist, or even from the infected dentist to the patient. So it can occur in both the ways. And also vaccination of HBV is available for protection, and the universal precaution is taken by the dentist to avoid that of the transmission of virus. So coming to the next one, the important points. So the prophylaxis would include general preventive measures and also immunization, that is both active and passive immunization. The active immunization would be the two types, that is the plasma-derived and the plasma-derived vaccine and the recombinant yeast hepatitis B vaccine. And the passive immunization would include the given of the vaccination, which is given to that of the doctor when getting exposed by mistake from the patient. The clinical dentistry points include it's a main parenteral route of transmission, the increased risk of infection will be present, and the mode of transmission can occur from the patient to the dentist or even vice versa. So thus HBV vaccine is very important to be given for a dental practitioner and even for a medical practitioner before he joins the clinical setups. So yeah, thank you. We come to an end. If you had liked my class, please do like and subscribe, and also please tell your friends about it. Thank you very much.